Viactiv is a combination medication used to prevent or treat low blood calcium levels. It can be used for conditions such as osteoporosis, osteomalacia, hypoparathyroidism, and latent tetany. It is also used to ensure that certain patients are getting enough calcium, including pregnant, nursing, or postmenopausal women, and people taking certain medications like phenytoin, phenobarbital, or prednisone. Calcium is essential for the normal functioning of nerves, cells, muscles, and bones. If there is not enough calcium in the blood, the body will take calcium from the bones, weakening them. Vitamin D helps the body absorb calcium and phosphorus, which is important for building and maintaining strong bones. The recommended daily dosage and optimal timing for taking Viactiv will depend on individual needs and should be discussed with a healthcare professional. When taking Viactiv, it's important to take it with food. If your product contains calcium citrate, you can take it with or without food. Make sure to follow the directions on the product package or as directed by your doctor. For best absorption, if your total daily dose is more than 600 mg, divide your dose and space it throughout the day. If you are using the liquid form, carefully measure the dose using a special measuring device/spoon, and if you are taking the chewable form, chew thoroughly before swallowing. If you are taking capsules, swallow each capsule whole. Do not crush or chew extended-release tablets, as this can cause an increased risk of side effects. Swallow the whole tablet without crushing or chewing. Take Viactiv regularly at the same times each day to get the most benefit from it. If your doctor has recommended a special diet, make sure to follow it to get the most benefit and to prevent serious side effects. Do not take other supplements/vitamins unless ordered by your doctor. There are different forms of calcium supplements available, so it's best to ask your doctor or pharmacist to help select the best product for you. If you think you may have a serious medical problem, seek medical help right away. If you experience constipation or stomach upset while taking Viactiv, be sure to consult your doctor or pharmacist. They can help address any ongoing issues. It's important to note that many people using Viactiv do not experience serious side effects. However, it's crucial to seek medical attention if you notice any of the following serious side effects: nausea/vomiting, loss of appetite, unusual weight loss, mental/mood changes, signs of kidney problems, bone/muscle pain, headache, increased thirst, increased urination, weakness, tiredness, or fast/pounding heartbeat. While a serious allergic reaction to Viactiv is rare, it's vital to seek immediate medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. And as always, consult your healthcare provider for medical advice about side effects. Before taking Viactiv, make sure to inform your doctor or pharmacist about any allergies you may have, especially to vitamin D products. It's important to also discuss your medical history, especially if you have conditions such as high calcium/vitamin D levels, difficulty absorbing nutrition, kidney disease, or certain immune system disorders. If you have diabetes or phenylketonuria, be cautious as the chewable tablets may contain sugar or aspartame. If you are pregnant or breastfeeding, consult your doctor before using this medication. As always, it's important to discuss the risks and benefits with your doctor before starting this medication. It's important to be aware of potential interactions between Viactiv and other medications you may be taking. Some products that may interact with Viactiv include digoxin and phosphate binders. Calcium in Viactiv can decrease the absorption of certain drugs such as tetracycline antibiotics, bisphosphonates, levothyroxine, and quinolone antibiotics. It's recommended to separate your doses of these medications from Viactiv, and consult your doctor or pharmacist for a dosing schedule that will work with all your medications. It's also important to check the labels on all your prescription and non-prescription products, as they may contain calcium, phosphate, or vitamin D. Vitamin D is very similar to calcitriol, so it's advised not to use medications containing calcitriol while using Viactiv. Additionally, Viactiv may interfere with certain lab tests, so it's important to inform your lab personnel and doctors that you are using this product. If you or someone else has taken too much Viactiv and is experiencing severe symptoms like passing out or trouble breathing, it's important to call for emergency help right away. In the US, you can call the local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, changes in mood, headache, drowsiness, weakness, and tiredness. It's important to seek medical help if you suspect an overdose. When taking Viactiv, it's important to have regular lab and medical tests to monitor your calcium levels. Make sure to keep all your medical and lab appointments and consult your doctor for more details. You can also get vitamin D from foods such as fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and fatty fish. Your body also produces vitamin D when you're exposed to sunlight. Incorporating foods rich in calcium into your diet can also help, such as dairy products like milk, yogurt, cheese, and ice cream, as well as dark green leafy vegetables like broccoli, spinach, and bok choy, and calcium-fortified foods like orange juice. To reduce the risk of bone disease, staying physically active, not smoking, and avoiding alcohol and caffeine can be beneficial. And remember to take Viactiv as directed by your healthcare provider for optimal results. If you forget to take a dose of Viactiv, take it as soon as you remember. If it's almost time for your next dose, just skip the one you missed. Take your next dose at the usual time. Don't take a double dose to make up for the missed one. Keep Viactiv at room temperature, away from light and moisture. It is important to store it in a safe place, out of reach of children and pets. Do not flush Viactiv down the toilet or pour it into a drain unless instructed to do so. When it is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.